Hi everyone, my name is Lisa and I'm an MSc Global Health graduate. I was the first author for this paper, applying equity-centered principles in an interprofessional global health course. So the greater awareness of health inequity has attracted more students and professionals to participate in global health initiatives. But without the appropriate training, these students and professionals are commonly unprepared to address the many complex issues that emerge while working in low-resource settings. So in response to these concerns, the Canadian Coalition for Global Health Research, CCGHR, developed a set of research principles that encourage equity-centered research and practice, as seen in this photo. So currently, global health courses mainly focus on content learning and not on attitudes or values, and this is seen as a gap in global health education. Therefore, a new course was developed at the University of British Columbia, and it was based on the CCGHR principles as seen in the last slide, and it focused on the values and attitudes of students. So the purpose of this study was to, 1, analyze the extent to which the course was effective in focusing on student attitudes and values, 2, identify the successes and challenges of the course, and lastly, explore the extent to which this course filled the gap with respect to the teaching of global health. There's 25 interprofessional students, and they are from various parts of the world, many from the global south. There are 3 professors from 3 different universities, and 3 data collection methods were used for this study: surveys, interviews, and participant observation. So the key findings were that student attitudes regarding global health research and practice significantly evolved towards the views consistent with the principles articulated. The greatest perceived success was partnering across different universities to deliver this course. Students felt that having multiple professors provided them with a multiplicity of views and approaches. However, some students found the lack of clarity and leadership to be detrimental. The interprofessional nature of the cohort was considered a strong asset, as was the fact that many students came from the global south. In the future, this course could be strengthened by partnering with institutions in the global south and with participation from First Nation communities. Students and instructors felt that this course did focus on attitudes and values in comparison to the previous courses they were involved in. Therefore, it was perceived to fill the identified gap in global health education. So in conclusion, with the proper preparation and strategies to address challenges, a course focused on the CCGHR principles could be useful in preparing the next generation of researchers and practitioners. And global health education should reorient to focus not only on knowledge, but also on attitudes of aspiring global health professionals. Thank you for listening, and feel free to email me any questions.